Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. We have a very special person, Dr. Praveen Venkatagiri. He is MRCP, FRCP, a neonatologist par excellence, working in Chinmaya Mission Hospital. And he is going to tell us the transition of the baby in the mother's womb to the birth, because this is very precious. There was a time when we used to people used to have 10 children and 2 people used to die, and whenever the child used to die, they say, oh, that is the hanebara, that is the fate of the child, and nothing can be done. And I don't believe, because I myself, I have saved a hydros fetalis 14-hour baby which had a pinpoint aortic stenosis, and I did the balloon dilatation and saved it. So the transition is very important. Unless the child cries, we are not happy. And here the role of neonatologist comes. And the parents, now we have the all scanning, everything, but then the role of the neonatologist is very, very important. So please tell us, what is the role of neonatologist when the child is born or to be born? Yes, sir.
Thank you. Neonatologist essentially means the specialist who are pediatricians, but more trained in dealing with the problems which occur from the time of the delivery till about 1 month of age, typically.
Yeah.
So that's what are the neonatologists. And the main goal is to look at prevention of certain problems by working as a team with the obstetricians and the parents in ensuring that certain interventions are done prior to the delivery and at the time of the delivery, along with the team, ensuring that the transition that you rightly mentioned happens, and then identifying any problems if they have at that point or next within the first few days of life, then providing treatment in the intensive care, which is called as newborn intensive care or NICU.
Yeah, very true, sir. And but today the things have changed compared to what it was 30 years ago. Now, most of the women, because for them it's a precious baby, they're getting married late and they're becoming pregnant late, and then they're precious babies, and then they would have used the IVF. But what happens is they would have got all the investigations, especially the ultrasound, but still there is a risk. Please explain to them, sir.
Yeah. So as we know, the science progressing very fast. At the same time, there will be more because more information, it's better for us to take actions earlier. The ultrasound is done much earlier when the baby is very small, like a fetus, right? At that point, it is done to see if there are major problems. If the major problems are there, whether the fetus is fit enough to continue or not is the decision.
Yes.
That's why it is done very
And
early.
especially the chromosomal diseases, if there are any genetic disorders, and that can be taken care of. But then today we will talk about the premature babies and the other babies who are having risk at the time of the delivery. So please
Yeah.
tell us what is this premature baby and what problems they have.
So we know that 9 months is the full term, but typically less than 37 weeks completion if any mother is giving a birth, it's called technically premature. Now
Okay.
we deal anywhere between 23 weeks, 24 weeks till the 37 weeks like that. The babies who are born less than 34 weeks tend to have more problems. As you would expect, the mother manages all automatically when the baby is inside the womb. The moment
Yes.
the baby comes out
Yes.
early, their
Yes.
organs are not yet ready to face the world. And hence,
Not mature enough to face the world. Okay.
yeah, it's a maturity is a journey. So
Hmm.
we are testing at a point where we're not given them enough time to grow. So
Correct.
hence
Yeah.
they may. It is not that it is stopped. So that's something people get worried that like if somebody is born premature, that means they're not going to grow. No, it's not like
Yes.
that.
No.
At that point, they are not ready to face the world, and hence they need the support. The
Yes.
support in terms of something what we call as temperature,
Hmm.
breathing, which means the
Hmm.
oxygen support, then the
Hmm.
feeding, which required for the glucose support,
Hmm.
and protecting, like how mother protects inside, the infection is something that can vary. So hence
Correct.
we place them in NICU, ensure that the temperature is maintained, ensure that their oxygen levels are good, which with the support of machines like something called CPAP or ventilator, we provide medicines into the lungs, because once the lungs mature, the oxygen circulation improves. And then
Automatically.
we slowly start the milk, because the gut is not matured yet. Hence, we have to be very carefully calculate even the smallest quantities of mother's milk, which is the ideal, and that's the
The
best
best.
medicine
Yeah.
that we can give compared to
Yes.
any medicines that we have. That's
So
where
that
mother can
not
support.
only increases the immunity, it gives the best complete holistic nutrition to the baby. Yes, sir.
Absolutely. So that's a
Mm,
huge role of the mother, that, like,
mm,
when mother can provide the touch and the milk, that can
mm,
really help the baby in the short term as well as the long term. So that
mm.
is something we give through a tube, small tube, which is placed inside the mouth, directly
Rice
delivers
tube.
into the
Yeah.
stomach.
Yeah.
Yes, it's a Riles tube. And then,
Yeah.
of course, we ensure that every day several parameters are monitored, several wires are connected to this premature baby, to
Mm,
ensure that any problems which may occur, we
mm,
anticipate early and actions are taken, because
mm.
this baby may be there for 1 month or even 3 months in the NICU, and that's
And
where, as a
especially
team.
especially when they are born with a very small weight, like 600, 700 grams, and that becomes very difficult. The whole surrounding is harsh, so your role is extremely important there. Yes, sir.
Yeah, so as a team, that's something we all do that. So mother's milk and something called KMC, kangaroo mother care, which where the
Kangaroo
skin
mother
to
care.
skin
Yeah.
contact will be extremely important, and we urge parents to participate in this. Both mother and father both can do the kangaroo mother care, which
Yeah.
helps the child to grow well, and for brain development as well, it helps. So
Yeah. Yeah.
that's in kind of a, just in terms of the prematurity care. Lots of ups and downs. It's not easy. It's like going
I
through a
know, I
storm.
know, I know, I know.
So
I know, the life journey itself is very difficult, but the tiny baby journey is more difficult. See, when we grow up, we are capable of facing the challenges, but that baby is not. So then we have to assist. So it is not only parents, they are ignorant. At that time, the neonatologist helps and trains the mother as well as the parents how to do it. And that's a very important thing, sir. Yes, sir.
yeah, yeah. So if we divide, one is the preparation, second, at the time of the delivery, what actions are taken, and then ongoing every day, there will be several actions are taken. At the
Mm.
same time, I also want to emphasize that please do not think that at the time, once the baby is discharged, that's the end of it.
No.
Definitely, there will be many follow-up requirements, like for the eye
Yes.
development and general growth and development needs to be assessed. Kindly
Mm.
do not ignore that, because the
Yeah.
ultimately it is your child's long-term health which will depend on how you as a team,
Yes.
mother,
Yes. Yes.
father, family, supports the child. And if
In fact, I say the mother is the first doctor, and she has to detect any problem with the child, whether it's a learning or the motor or the mental milestones. All that can be detected by the mother,
yeah,
and especially the newborn babies. I know it is very difficult, and the mother also needs the assistance. Not only
yeah.
the child, even the mother needs the assistance. Yes, sir. I agree with
Absolutely,
you.
absolutely.
Yeah.
I mean, mine, especially recorded in the newspaper, was about 470 grams that I had managed about 10 years back.
Mm,
The lot of credit was given to me and the team, but
mm.
it's the obstetrician who was who able to give the steroids before the delivery, and it's a
Ah,
mother
that is very
who
important. Yes, yes.
yeah, and it's a mother who kind of gave the mother's milk and
Mm,
then continued the care, and the
mm.
father who supported the mother and financially
With
also,
it.
because this is
Mm,
expensive affair as well. Imagine
mm,
staying in the hospital for 3 months.
mm.
So everyone has a role. It is not just the neonatologist and the nurses who are there
Yes,
continuously taking
yes.
care.
They have to be
Extremely
very clean and
important.
nice. Yeah. Yes,
Yeah,
yes,
yeah. So we
yes.
definitely, without a good team, there is no way we can talk about the numbers of the weight and, like, how they have done. But at the same time, we all know that how difficult it is to manage any sick baby unless the team is right.
Yes. So you act as a captain, but then, each player, the father, mother, And the nurses and the obstetrician and all of them, they have to work their own role. Without the teamwork, I mean, that baby cannot be brought to the, what to say, the bright future cannot be brought for the baby. Extremely important, sir. Especially, what tips you would like to give it to the mother?
So again, if we look at it from the pregnancy time, everything that has been kind of prescribed by the doctor, they must take care.
Mm.
Nutrition must be correct. Again, you consult your
And the
doctor if required.
folic acid should be
Well,
added and taken compulsorily along with the
absolutely.
nutrition. Yes.
Absolutely. And the activity as prescribed by the doctor is also
And the
very
vaccine,
important.
along with the activity, vaccines also to be
Yes.
taken. Yes, sir.
And stress again,
Mm.
right? Again,
Ah,
involving the
most
family from the
important.
beginning,
Mm,
very very important in terms
mm,
of like pregnancy. You enjoy the pregnancy, no doubt on that. And
mm,
also at the same time be prepared in terms of what all can happen and how we can negate it. Certain things
yeah.
you can't, you may not be able to predict or stop it, but whatever is whatever you can predict, whatever the doctors are going to say that like, and these are the risks which are there, can you
Mm,
mitigate that?
mm,
Please take those actions rather than
mm.
just blind belief that no, no, everything will
Worrying
go
and
right.
then by
Yeah, yeah,
putting the blame on the what to say, that their future or whatever it is, that stress is not right, because
yeah,
stress is going to have a negative impact. Instead
yeah,
of that, if they prepare for the war, and then the war may be not required at all. So you are absolutely right, sir.
yeah,
Absolutely
yeah.
right. Yeah.
And talk to the team, like, then at the time of the delivery, it's a very scary situation when you are expecting a particular date, and even a month or 2 months before, if you are told suddenly that you are delivering a preterm baby,
Hmm.
that is something mother, nobody can explain except that mother who is going through what really she's going
I
through.
know.
So
I
she's
know.
suddenly expecting a baby, her dreams of the baby looking different, like 3
Hmm.
kilos, 3.2 kilos, like that, and
Hmm.
suddenly you have a baby who is barely a kilo, and the skin
Yes,
looks
tiny
different.
one, tiny
Yeah,
baby. Yeah.
tiny. Not only
Mm,
weight, the appearance and the reactions are going to be completely different, and you may get a shock of that, right, at that
mm,
point. So, hence,
mm,
talk to the people. They will
mm,
reassure you, saying that, like, this is something normal, just give more
mm,
time, right?
mm,
So,
mm,
that mental preparation at that time and taking the support is extremely important. If
mm,
she's able to overcome that, because she's going through her pain as well of the delivery and
mm,
her changes in the body of the hormones, at
mm,
that time we need the precious milk. So
mm.
if mother is a part of the
If
team
she's
and she's
under the
able to
stress, she
understand.
will not get the milk. You are absolutely
Exactly,
right. Yeah,
exactly.
this is
And
exactly what I tell them, because if they worry, the mother, the child will not get the milk. And if the milk is not there, the child will not survive. And that's why I tell the fathers, keep all the worries for you. Don't transmit it. Don't make the mother worry about it. That's absolutely right, sir. Correct.
yeah, yeah. So that worry word itself, worry comes from lack of information, lack of understanding. And that
Yes.
if somebody is able to understand whatever can be known, if it is known, then there is no need to worry. We just need to take actions. So
Yes,
mother can
and
help
I
us.
do agree here, sir. Once upon a time, they used to say ignorance is bliss. But I say ignorance is a crime. Because if you ignore something and if you are ignorant, you are going to face more challenges and more problems, and you're going to get into the irreparable damage for the baby. And I absolutely agree with you, sir. Correct,
Yeah.
sir.
So there we need that colostrum, that is the early milk that is produced, which is called as yellow gold, liquid
Yeah.
gold,
Mm.
and that really helps the baby in fighting the infections, short term as well as the long term brain
Long
growth
term.
as well.
Yeah. Yes.
But again, you can take help of the nurses, lactation nurses, or
Mm,
your mother or the family members as well
mm,
to
mm.
express that milk. This is extremely important.
Yes.
And also come and visit in the NICU. NICU can be a very scary place in terms of it's
Mm,
dark, lot of
mm,
noises are there, some blue lights can be there, lot of
mm,
wires are attached to the baby. Again,
mm,
talk to the people, talk to the nurses. They'll explain to you why it is there.
mm,
It can be scary, and we understand that. We all went through the
mm,
moment first time when we entered the NICU. But
mm,
as a team, when you look at it, you will get more confidence. But your
mm,
presence is important as well.
mm.
So your visits to the NICU helps the baby to understand. You can talk to the baby, you can touch the baby, and once the baby is stable, nowadays even much before, immediately after the delivery itself,
Yeah,
attempts are
kangaroo.
made to
Yeah.
attempts are made to put the baby onto your skin. This is
Mm.
skin to skin contact,
Mm.
extremely important, not just for your kind of a mental health, also for the baby. It reduces the infection by many folds, and it reduces the chances of mortality. And
Mm.
also the long term brain growth is proven to be better in babies who
Excellent.
received kangaroo mother care.
Yes,
Hence,
and they
this is the
have the
medicine.
attachment, the mother and
Yeah,
child attachment will be there, the bonding, and the especially like a winter season like now, the
yeah,
baby, the warmth also will from mother it will get, and I think it has got multiple advantages, and the feel good hormones are released in the brain, and the
yeah,
mother feels very happy about the child. It may
yeah.
be tiny, but it helps her to grow the baby. Yeah, yes,
Also,
absolutely.
important thing that I keep mentioning to our parents when they come for the preterm delivery is that mother many times feels that I am not able to do anything. Is that my fault that, like, premature baby has
Mm-hmm.
is delivered, and the social pressure that she people have on her makes her feel that she's not part of the team. But in
Guilty,
fact,
yeah.
we are dependent on her to provide this
She is the
vital.
pillar. She is the
she
pillar.
she is the, we can't do what she can do there, right? So
Yes,
it's and also we know these are the most powerful medicines than any other medicines that we are able to
correct,
provide. So
correct.
kangaroo mother care, touch and being present there, milk when she can provide, these are the basic level things which we cannot do. And of
Mm,
course she can participate in every discussion. I
mm,
know many I meet many families who say that we do not want to tell the mother
mm,
the challenges, but
mm.
I believe that mother has a lot of strength. If given
I
information is
know, I
given,
know, I know.
they will be extremely useful in
Yes,
helping us to take the
yes.
right decisions.
Yeah, mother is the strongest person and she is the greatest support for the baby, and she must be prepared. So prepare for the worst and do the best, and that should be the policy for all the mothers. So thank you very much for your such a very simple and so beautifully you have explained. So thank you very much, sir.
Thank you.